Hey everyone, compensates here. In this video, I want to go through a couple of mobility drills that's going to help you increase your range of motion in a squat. So helping you get into an ass to grass squat, as well as your range of motion in terms of a deadlift. For our everyday lives, being involved in our everyday activities, sometimes we move in unconventional ways that prevents us from firing the right muscle groups, disengaging muscle groups, as well as switching off certain muscle groups that allow us to explore those ranges of motion. So what we need to do first, of all, is test our range of motions in terms of a squat as well as a deadlift, and then go from there. Testing your range of motion through a squat test as well as a hip hinge test. All you need is a broomstick for one of the exercises. If you don't have a broomstick, Kmart, Target, pinch it from your neighbors, borrow it from a sibling, whatever you got to do. Test out your range of motion. So performing the hip hinge test, you want to place the broomstick behind your back, having 3 points of contact just above your glutes, your mid back, as well as your head, and positioning your feet shoulder width apart. Now you want to be folding at the hips, keeping your legs straight, and then accentuate that movement that you would in a hip hinge, in a deadlift, or a stiff-legged deadlift. The aim for this exercise is you want to be parallel with the floor without losing any contact with the stick. If at any point you're hinging and the stick comes off, losing 1 point of those contacts, got to ask yourself, where am I breaking? Do I feel stiffness on my hamstrings? Do I feel like there's a block in my hip? Can I perform a hip hinge effectively? Recruiting the right muscle groups, as well as having that clear path of movement for my hips to travel back in hip flexion. The second test that you want to perform is just a general squat test. If you don't know how to squat, it's as simple as sitting down, making sure that your torso is leaning forward, from a side profile. You want to be going as low as you can, or parallel, ass to grass, ass to grass or parallel, right? If you are at any chance squatting and you're getting stuck around that 30-degree mark where you just can't go anymore, there's a couple of points that you have to address. It's either, are my knees traveling past my toes without my feet coming off the ground? Do I have adequate amount of ankle mobility, or am I breaking at the hips because I can't go anymore because of a blockage or a pinch sensation? So we're going to be addressing the pinch sensation that's preventing you from actually clearing that path and extending that range of motion for you to allow yourself to descend effectively to that parallel or below parallel, as well as generate a greater force output from a greater range of motion, and as well following exercises of strengthening and activating those new found ranges of motions. What we're going to go through now is band mobilization exercises to restore the relationship between your femur, your thigh bone, and your hip socket, so you can have adequate amount of external rotation, thigh coming out, internal rotation, thigh coming in. Something that we overlook as trainers, myself included, as well as your everyday gym goer, is providing adequate amount of internal rotation. Internal rotation, it's important in terms of athletic performance, decelerating movement, and force production. Not only that, it's used in your everyday function of walking. When you don't have adequate amount of internal rotation, what you would see people doing is they would either compensate their movement either by externally rotating their toes, their knees coming in, or their lower back being compensated. Our body is designed to go down the path of least resistance. So if something is compromised in our chain of movement, something's got to give. How you can assess this simply is by laying on your back, lifting one leg up, having your hip in flexion, making sure you've got your hand here for support, and just seeing how much you internally rotate and externally rotate. So you want to have your hip placed as well on the ground. So you can see that's my right side, my left side. So what is the golden ratio? What is the golden number you want to look for? Internal rotation, anywhere between 30 to 45 degrees, as well as external rotation, anywhere between 35 to 45. It depends on each individual. Some people may be super mobile, some people may be a little bit rigid. If you're falling into the area of 20 degrees, then you definitely need to work on this. So without further ado, let's get straight into the exercise. Having a thick resistant band, you want to attach it to a pole. Once you do this, you want to sit one of your hips inside. So it's going to be pulling you on a diagonal motion, and you want to have the band in tension. Once you have it in tension, I'm in this running lunge position. I'm leaning forward and I'm rotating in and out. Holding these ranges of motion 2 to 5 seconds. If I'm still feeling a pinch, I can step out further to just alleviate that pain. So when I'm pushing out, I'm making sure my foot is positioned straight. I'm gripping the ground with my foot to just work on foot stability and strengthening my foot muscles as well. So it's a complex movement, but so effective when you get it done right. So I'm just going in and out, and I could already feel that stretch in my adductors, my inner thigh. So you don't want to be like full on belting out, but you just want to give yourself that permission to just allow your body to trust you to say, okay, I'm exploring, I'm experiencing, how much more can I do? So that's external rotation. How you can work on internal rotation is simply, if you have a cushion, place your foot parallel to the floor. And what you want to do here is simply internally rotate, so thigh coming in, bands in tension, and I'm just gliding at the hips. I can either further exaggerate that stretch furthermore just by throwing my hips back, and I'm making sure my line of force is going directly down into the pad from my thigh. So you should be feeling a bit of pressure towards that movement. You can also add resistance, further resistance. So this is going to be working internal rotation. You could feel it already. Making sure that you're driving that force directly into that femur bone, into your thigh bone. Add a little bit more torque. Yeah, I can feel a great stretch in my TFL, which is the area near, the muscle area near your pocket. If you want to add some external rotation, you can as well. Simply sitting in hip flexion, so making sure that your hips are flexed. So you want to contract, hold, and then rest. What is the golden number you want to do this? I would say anywhere between, if you're going for reps in the first exercise, go anywhere between 8 to 12. If you're going for duration, I would say anywhere between 30 seconds to 2 minutes, 2 minutes being your therapeutic dose. However you feel, after each mobilization drill, you want to test your range of motion, right? So testing your squat, I already feel very mobile in terms of my right hip socket joint, my right hip capsule. So really important that you test your range of motion. So you can see internal rotation, external rotation, providing adequate amount in terms of restoring that relationship. Once you prioritize the pelvis, the supporting hip muscles around the hip socket joint, your lower back is going to thank you greatly. And remember what I mentioned previously, if you're not working on in terms of improving your range of motion, it's really important to follow the next step in terms of strengthening it, this new range of motion, so you can somewhat permanently keep it. So we're going to go into that in the next exercise. So the first exercise that we're going to be doing for external rotation, meaning the femur rotating outwards, is clam shells. What we're going to be doing is laying on our side, having a closed band loop, more shorter compared to the traditional resistant band. When we're placing this above our knee and laying on our side, having our hips not directly straight, but rotating, or sorry, moving it upwards towards, I would say, a 30 to 60 degree, whatever way you're looking from it. From there on, making sure our heels are in contact, and then just opening up our legs, emphasizing the pull coming from our knees, right? You should be feeling a side bum. You should be feeling your side bum burning in this drill. And I'll be performing anywhere between 15 to 20 reps. And again, holding those endpoint contractions for around 1 to 2 seconds. Slow on the negative movement, the eccentric movement. If you want to challenge yourself further on this drill, you can lift up your core, making sure that your torso is straight. This is going to allow you to work on your obliques. And then you can challenge yourself even further by lifting your body weight from your knee and your elbow and making sure your hips are up to work 2 muscle groups of your glute medius, your side bum, as well as your obliques. Again, with the glute medius exercise, with the firing the abduction of the hip and working on external rotation, I would perform at least 1 set before a workout. And if I'm working any hip mobility drills on my rest or recovery days or a mobilization day, I would probably incorporate that twice to just really get that signal and just solidify that new range of motion to make it more permanent and just get that neuromuscular connection more established. With the internal rotation, we've got how you do internal rotation is basically positioning your feet just outside shoulder width, and you'll want to be rotating. You can see my right side is just so much more mobile because I worked on the right side compared to my left. So, right, my hip isn't coming off the ground. I'm not shooting up my hip. I'm literally just letting my hip do the work, pressing it from my knee. Again, going to the point of strain. I don't want you to just really beat yourself up on this point. Go to the point of strain, not pain. Wow, it's just amazing how much that band mobilization just made my right knee more mobile compared to my left. As you can see that one. So that's something you can perform, these mobilization drills, 15 to 20 reps beforehand. If you want to challenge yourself further, get a light resistant band, slide the band just above your knee, and again, same position. What you want to do here is just really exaggerate that pull, right? Again, nice and slow on the way back, holding that contraction, making sure you're driving that force from the knee and making sure that hip is positioned at the bottom. That is a further progression that you can work on. 15 to 20 reps. And last exercise that you can incorporate as a supplementary compared to the hip internal rotation activation is just laying on your back, positioning the band just above your ankles, and just really working on that activation. So bringing your legs in 90 degrees and just really holding that, making sure that your feet are in 90 degrees as well. And again, working between 15 to 20 15 to 20 reps and making sure that you're holding those contractions anywhere between 2 to 5 seconds on this one. So there you have it. That is a great way to assess your range of motion through testing your hip hinge as well as your squat test to see if there's any types of blocks that you're feeling in terms of your hips. If there's a pinch, if there's a block, test out your internal, external rotation. Do you have adequate range of motion? Is it 30 to 45 degrees? If not, do some band mobilization work, and after you felt the improvement, if you felt the improvement is working, then focus on activating and strengthening that new range of motion.